tonight at 5, health officials in Wisconsin are bringing attention to an alarming trend of COVID-19 cases among children. They say numbers are heading in an unsettling direction, and tonight, Taylor Lumpkin shows us why.
It's a trend in Wisconsin that's starting to cause some concern. The number of kids in the state who are testing positive for COVID-19, as well as who are being hospitalized for the virus, is steadily on the rise. According to Children's Wisconsin, just in this past week, 12 children were hospitalized at their Milwaukee campus after testing positive. 10 were admitted the week before, and 5 children were hospitalized the week of September 8th. Meanwhile, the percentage of rooms occupied by kids with COVID-19 at Children's Wisconsin Milwaukee Hospital is also slowly going up. This week, 28% of rooms were filled with children who had COVID-19, a 4% increase from the 24% who occupied rooms 2 weeks prior during the week of September 8th. Health officials say COVID-19 activity in Wisconsin kids continues to be high, with twice the number of kids testing positive for the virus compared to 1 month ago. Back in August, nearly 2,100 kids between the ages of 0 and 17 had tested positive in Wisconsin. And as of last week, more than 4,200 children in the state have tested positive for the virus. In a statement regarding the rise in cases in kids, Children's Chief Medical Officer Dr. Michael Gutzeit said, quote, "The best way to stop this trajectory and protect our kids is through the precautions we already know work. I encourage families and school districts to reinforce the use of masks to decrease the spread of viruses." Health officials add that they are encouraged by the news that Pfizer is inching closer to vaccinating kids between the ages of 5 and 11. In Milwaukee, Taylor Lumpkin, TMJ4 News.
Well, good night, everyone in the Cayman Islands. Welcome to the CMR COVID Spotlight Series. I'm Kevin Watler, and Sandra is in the background. She's going to be helping out, keeping an eye on a lot of the comments. And any questions that you have, just post it on either Facebook or YouTube. We'll keep an eye out for it, and we'll definitely get to it. And so want to make sure that everyone shares this with everyone you know who's a parent, a grandparent, or even a soon-to-be parent. We want this information to get to as much people as possible. A lot of really valuable information is going to be shared. We have a very, very experienced expert on the show who I'm going to introduce to you now. It's going to be Dr. Claudia Espinosa. She is an associate professor of pediatrics with the Division of Pediatric Infectious Diseases at the University of South Florida. And Dr. Espinosa, she completed her residency in pediatrics at the University of Kansas and her fellowship in pediatric infectious diseases at the University of Michigan. Dr. Espinosa, she is board certified in pediatrics and pediatric infectious disease, and her research interests include prenatal and congenital infections, hepatitis, and vaccines. So she is definitely someone who could share a lot of really valuable information on it. And one of the things is that we want to also just highlight right before we bring her on is kind of where Cayman is in terms of cases. So we do have currently 15 new cases that were reported today. Of those cases, 12 were unvaccinated and 3 were vaccinated. Out of that, the community positive cases, 10 of those were community positive cases. So that was community spread cases, and 5 of those cases were in travelers. We do have 128 active cases. So a lot of cases going on now, a lot different than it was this time last month. And 1 is still hospitalized, and from the last report was doing quite well. And there's 127 who are not hospitalized. They're still working out how many people are in isolation, as you can imagine, with the amount of cases that's coming in. They're still trying to put that together. And of those cases that we have, 55 they have symptoms, 73 don't have symptoms, and we have no new deaths to report. Vaccines continue to go up. 78% of folks there have at least 1 dose of the vaccine, and about 74% of folks in the Cayman Islands have 74% have at least 2 doses. They've completed the full series. So we'll now bring on Dr. Espinosa. Welcome to the CMR COVID Spotlight. How are you doing tonight?
Thank you, Kevin. I'm doing good. Can you hear me okay?
Hearing you loud and clear. Really thank you for taking the time to be able to share your knowledge, the experience that you have with the people of the Cayman Islands. Right now, just to give you a little idea of kind of the situation there. Unlike where we are, you and I are in Florida, and unlike Florida, the Cayman Islands has been in a bubble ever since the first few cases started to spread throughout the island. The government, they really closed the borders off, and they really did all of the public health measures to ensure that COVID was not going to have a chance of spreading. And so there were no cases for majority of the pandemic, really, other than when travelers were coming in, they were in quarantine, and there was no community transmission. It's only recently when it seems that some community transmission is starting to occur. Not exactly sure why. It could be someone that was supposed to be in quarantine that decided to come out, or it came in from some other means. It's not exactly sure why, but there is community transmission happening within the schools. Most of these cases are popping up with kids. A lot, just about every single day, even up to today, there are new cases identified. So it's getting there. At the same time, the Cayman Islands government is looking at opening its borders, but they're trying to figure out exactly when to do that and how to do it in a safe way. So they're looking at a bunch of different things, some more controversial than others, but either way, the borders will be opening at some point, and so they're just doing what they can to prepare. So really, Cayman Islands in a much better place than most of the world. But parents now are trying to figure out exactly how best to protect the little ones, because not all of them could get vaccinated quite yet. But at the same time, there's a lot of questions, a lot of misinformation and disinformation, a lot of really confusing things that's going on out there. So we just want to kind of have a conversation, and as questions come on in from folks who are watching, we'll just go ahead and ask them. But let's go ahead and get started with the first question, which is, some people say kids don't need. Oh, go ahead.
Can I just say a one sentence about those numbers? Probably, I saw
Sure,
the rate.
absolutely. Go right ahead.
I saw the rates of vaccination there. It's pretty good. 78% vaccinated people. I mean, available, or the ones that can get the vaccine. That's great. That's what, cases will happen still in unvaccinated, but they will not die. They will not be in the hospital sick and have bad outcomes. So that's the beauty about the vaccine. And I think that's probably why you are seeing those numbers and cases rising in the school, because obviously little kids cannot get the vaccine. And so probably that's where we are going to see more community transmission. But thank you for giving me a map of what is going on there today.
No problem, and really thank you for sharing that. I mean, when I look at the numbers, and I tell all of my coworkers, at the health department where I work, Cayman has been doing such an amazing job, really, at really making sure that they're putting public health first. Not everywhere can really say that, because there's a lot of different political pressures, just a whole lot of different reasons. People have different views on things, and not necessarily listening to some of the science. And that's why we need people like you, who you're not just a pediatrician, but you're also an infectious disease doctor who really know what you're talking about. I mean, this is what you do. Just read off your credentials. And so I wish people would really take information from professionals in the field, rather than reading on social media, or sometimes trying to read some of the very complex information that might be out there without really understanding what you're reading, because it's not necessarily the easiest thing to read. I know even when I go to the CDC website, sometimes I get lost and confused, and I have to go to my epidemiologist or someone that I work with and say, hey, please break this down for me, because this is a bit difficult. So, I mean, this says this, but it also says this, but the two kind of almost seems like it's contradicting. I'm confused. Please help me. And so
You're not the only one. I can assure you are not the only one in that spot.
Yeah.
Well,
So
I'm
I
happy
mean,
to be here. So.
Absolutely. And I mean, really appreciate you being able to come on and try to discuss some of these questions. I see some questions are starting to come in. And my first question would be, some people say kids don't need to worry if they get COVID, because COVID really affects older people. Is that true?
That is absolutely not true. I can tell you many stories of my patients that they should not be infected and they should have not end up in the hospital and they shouldn't have been in the ICU. So, from the first series that we knew about coming from China, right, from the first strain that we got, the cases for kids were really, really low. And we thought that it was maybe because they were not doing good with testing. They were not testing that much. But then we have plenty of testing. And in other countries like UK, they had plenty of testing. But still, they were getting infected. It's just that two things. Many of them may have less symptoms than the adults, right? And their bodies are different, and the way how they express those receptors that are the ones where the virus get attached to, they are different in their bodies. So that can be something that makes that difference. The other thing is that obviously kids are healthier, right, than adults, and they have healthier lungs than the elderly who has smoked all his lives, and so that will account for some of those differences. But by no means they get infections and they can be really sick in the hospital.
Okay. So, see someone, one of the Facebook commenters said, we would love Dr. Espinosa's take on having children under 12 who have sickle cell take the vaccine when it's available. Given and then she put in a link that's appeared in studies. Do you have any feedback on that?
Can you repeat the first part of the question, Kevin?
Right. It
Yeah,
says,
I can probably ask
Go ahead.
if you want, Kevin.
yes, absolutely.
Right.
Go ahead.
So her question, good evening, Dr. Espinosa. Her question is for children under 12 who have sickle cell. And if a vaccine is approved or when it's approved for that age group, given the link to myocarditis and pericarditis, should there be any concerns for a child who has sickle cell taking a vaccine, a COVID-19
Okay.
vaccine?
Sure. And that this answer may help with maybe other answers than people have in general regarding the myocarditis adverse event, right? That sounds pretty bad, to have inflammation of the heart. But what people have not really completely understand is that kids who have COVID per se, they have like 15 to 20 times more risk of having myocarditis than if they get the vaccine. So in other words, you may have an increased risk of a patient who had, or a child who had not had the vaccine. But if you are unlucky and you get the infection, then definitely you are gonna have a worse chance that the myocarditis is gonna be more more strong. It's gonna be worse. You are gonna spend more time in the ICU. The cases of myocarditis that we have seen, which had been noted in in teenagers and younger adults, are really mostly males, and they are pretty easy to treat in terms, they come to the ER with pain. They may be in the ICU for a couple of days, be observed, sent home. That's probably the end of it. There are not adverse events that we can see later after that event. And so, on the other hand, I have seen the kids that get the wild infection and they can be in the hospital for days and the ICU for weeks. And that is disheartening. So when the CDC and the ICAP, which are the organizations that kind of tell us what exactly, and the FDA, of course, review all that data, they were able to conclude that even when there is this small chance of getting myocarditis, then the risk of having COVID and myocarditis secondary to COVID is much worse. Now, specifically for the sickle cell patients, they are in a high risk. At the beginning of the pandemic, I saw several kids that had sickle cell disease and were in crisis generated by the fever that the COVID causes, dehydration, right? Because they also have diarrhea. And I'm going here into the symptoms of COVID. So, anyway, many of the symptoms that these patients were having were causing that they will, patients with sickle cell will develop a crisis of sickle cell. And they will take longer to get better because there were more pain involved, more fever. And obviously, at the beginning of the pandemic, we didn't have absolutely any treatment. Now we have some treatment. We may do something, but it's still, it's definitely for that patient, I will recommend with no doubt that it's better to get them vaccinated as soon as the vaccine comes for that group patient.
Thank you. Well, one of the things you kind of almost touched on a
Thanks.
little bit, but it's
Um,
this: what type of children usually end up in the hospital due to COVID? Is it most kids? Is it kids that typically have a lot of health conditions, or is it could it be like just regularly healthy kids? What are you seeing in the hospital?
We are seeing all type of kids that never had any problems, and we are seeing kids that have tons of problems. So, this is interesting about this virus is we haven't figured it out. We haven't figured it out if there is a test or a marker that we can do and then tell parents, go home and don't worry, your child has minimum risk of having complications. Now, the other thing is that obviously those who have um, underlying conditions like diabetes, like chronic conditions, renal problems, they are going to be a higher risk of having complications, but it's not a direct correlation. One thing that I want to just advise everybody, the number of kids that we saw that were obese in the hospital was incredible. Like, I think that more than other comorbidities, obesity probably was the most common that we will see. So if your child is obese, and he has or she has COVID, then be very careful monitoring all those symptoms, because those are the patients that most likely will end up in the hospital.
okay, just a few more questions, and we want to remind our parents that if they'd like to join in on the segment and ask the questions directly, they can do so as well. It's just Cayman Mall Road / live stream. So they're certainly free to join us at any time. But in the meantime, we've got some additional questions coming in. Thank you so much, Carolina, for that question. Rachel says, would really appreciate guidance on ventilation and air filtration in schools. Are HEPA filters advised? And does opening doors or windows, taking class outside, any of those things useful at all?
Yeah, that's a great question, and the CDC has, a good information exactly like how much filter will filter and how many cycles you have to use depending on the space that you have. But in general, right, because that is very specific. In general, obviously, if you are a teacher, or you manage kids, or daycare or something, it's always better to do outside uh, activities. It's always better to have the air circulated. So opening the windows, if that is possible, is a good idea. Anything that has the circulating the air, that will help. But even we just had a big meeting, the Infection Diseases Society, a huge meeting in which we were talking about this, and really the most important thing, even more than the filters and even more than the circulation of the air, which is very important, it's really the masking. So if everybody's masking and they wear proper fitting mask, then the risk for having transmission in that setting is going to be lower. Obviously, if you are too close to your classmates or your friends, and you take your mask off because you are eating or something like that, you are going to be a higher risk too. So, for example, in schools, for example, we worry extremely about gyms, right? Gyms and the place where they take the lunch, because in those places is where the most risk is going to be of getting infection. So, like, when we advise the schools, we make the calculations depending of the area of the or the size of the room. Then we make those calculations about how many filters or what air type of air filters they need for the room. So I think it's gonna be less complicated there because the weather is better than for example in North America, where they get into really big time and hard time during the winter time, right? Because it's too cold in the north. They can not just open the windows, and so that information in the CDC is mostly applicable to those places. But yeah, no, by all means, just try to space your kids in the classroom, keep them apart, hopefully more than 3 feet away, and masking all the time, and you will be fine.
Okay, thank you so much for that one. We have Nona who wants to know about the dosage, really, that would be given to children of the Pfizer vaccine. Is it the same as adults or is it adjusted down? Like, what changes do they make in a vaccine to make it, safe for children?
Great question. They were able to decrease the dose and show how the kids will maintain even better levels of the antibody that we want to produce, even better than the adults. So that's great. And we have seen that in other vaccines. For example, the HPV vaccine, right? If you vaccinate with HPV before age 13, then you can age 15. I'm sorry, then you only do 2 doses. But if you wait after 15, then you have to do 3 doses. And the reason is that because kids have a marvelous immune system, it works pretty well. And so that, because of that, they were able to decrease the dose of the vaccine. So actually, they are given, or we will be giving for the little ones, 1/3 of the dose that we are giving to the other patients and the other population of kids. The actual dose that is given now from 12 to 18 is the same, or 17 is the same one that is done for adults. But for the 5 to 11, we are gonna start doing, or it's gonna be approved. If it is approved, when it is approved, it is gonna be 1/3 of the dose of the adult dose for those kids. And then everybody should know that there are already studies ongoing which are evaluating the effectiveness and what is the right dose for the babies 6 months to up to 5 years.
Mhm.
So, Dr. Espinosa, I do have a question on testing, because some people are saying, well, I don't want my child to go through a PCR test because it's dangerous, or it may have some sort of carcinogen or something like that in the Q-tip. What's the truth to the danger of getting tested, if there's any, as well as, not wanting to put a child through that, if you want to call it, traumatic experience?
I can tell you, Kevin, that I haven't been traumatized, and I have had that test done so many times because of so many exposures. But of course, I am not a kid, although sometimes because I work with pediatrics, then it makes me feel like I am more than a kid than adult. But I can tell you that, there are several types of testing. For in the past, we had been discouraging anybody to use the antigen because it did not perform that well with the first variants that we saw. With the Delta variants, because it has so much viral load, then it's possible that it's performing a lot better, and so a lot better than the other strains. So probably that's okay to do. And now there are some home kits that you can just do at home. I don't think that that's gonna happen with other variants that may be in the way to attack us again. But I think that with the PCR specifically, so sometimes we worry more about the kids than they really worry about things. There is no harm. There is no way that that actually the Q-tip will cause a big problem, except maybe because of the rubbing, there is some discharge or some blood there. But those are not persistent symptoms that will cause a big harm to kids. I have, we have tested so many kids in Florida now, like repeatedly. And there are, I have experience because kids that are, for example, in chemotherapy, right? They have to come every week for chemotherapy. We don't admit any kid in any place in the United States, I can say, without testing. So, some kids need repeated testing several times, and none of them really complain that much about the test. Like we probably saw that at the beginning of the pandemic when probably there were less testing available. But now that there are more brands, it's everywhere. Then it's being easier, and I really don't feel that the kids are complaining too much about that.
And I got
But
one question on the PC. Oh, go ahead, Dr. Espinosa.
no, just to answer quickly your question or that question is that there is no harm in reality. It
Got it.
may be a little bit uncomfortable, but there is no harm.
Thank you. But one of the things that I am seeing and hearing, there's a lot of what I'm going to say disinformation on it, is some people are saying, well, PCR testing is going to be going away according to the FDA at the end of the year. What is there any truth to that?
I don't think it is gonna go away. What we will see probably is that we evolve, we make things better, right? Like those home tests actually are performing pretty good. And so I think that we will all evolve in terms, but the PCR is a very specific test. And we are doing PCRs for everything now. If you go to the hospital, actually many places, instead of getting just an antigen, or especially in the United States, you'll find a PCR testing for RSV, for flu, and then now they are adding COVID to it. So there are many kids that have, like, now the four viruses: flu A, flu B, especially now that we are heading into the flu season, the respiratory season. So I don't think that they are gonna really disappear. They may evolve and transform into something better, like everything. We certainly hate to do the PCR testing, and kids cough and spit on you and all that. No, not purposely, of course. That's what they do. And so a lot of people are looking into getting better testing.
Sandra, any more questions that came in?
Yes, Kevin, we do have some other ones. There's someone asking about the Kawasaki disease, and for kids who have that, are they at more risk?
So no, I don't think so. And I'm saying this without any data, more than my experience. But from all the kids that I saw getting either infected or having multisystemic inflammatory syndrome, which looks like Kawasaki, we did not see anybody coming back again. And so, meaning, like having repeated infection or problems or fevers or anything like that. So my conclusion with my limited data and only my experience is that probably if you got it already, you probably are not, you have less risk of having something like that already, because your immune system already was hyper exaggerating with the immune response, and now it's unlikely that it happens again. But there is no data actually looking into like, nobody has said that has increased risk of having either Kawasaki or multisystemic inflammatory syndrome or COVID just because you had in the past Kawasaki disease.
So we have I guess there's a comment here who's saying that if vulnerable students contract the disease, their experience could be fatal. So schools should be closing. What is the approach in terms of institutions managing COVID-19? Is it still, a recommendation that if you have an outbreak in a school, that the entire school has to shut down completely?
That is a good question. So I think I have to speak from my experience in the United States, right? And we did have closures, of course, but I can tell you that those places, those institutions that have closures, they did not wear masks. So for the first part of the comment, right, absolutely right. If you have a child that is in chemotherapy, that has cancer, right, that has something disorder of the immunity that is not making them, let them produce good antibodies. Any other one, diabetes, any other one, right? And yes, you don't protect them. Yes, they can be fatal. That COVID can be fatal. And so, but first of all, those patients are the minority. And it's not that we are being insensitive, right? What we saw during the pandemic and the closures of the schools was increase on mental health issues in kids. In a lot of teachers and parents and kids complain about the decrease on the scores. Standardized tests, all of them decreased. Kids were not learning to read. You name it. Many kids depend here in the United States on a school being open to be able to eat, because they get the breakfast and the lunch at school, and some of them stay there for after school care or programs. So really, schools are very important part of the society. And so it wouldn't be fair for the rest of the kids just keep the school closed and not sending the rest of the kids to get all the learning and all the important social skills that they are going to get at the school. The CDC, the Academy of Pediatrics, and many other organizations really came together and say we need to send them back. Now, the important thing is that we need to send them back safely. And I think that that's the part that a lot of people kind of forget, or for different reasons, right? We did very well last year in many schools, many districts, many states, pretty well, and we didn't even have vaccine. And there were kids at school, but everybody was masking, everybody was using the hand sanitizer, everybody was distancing. So we had a lot of processes in place, and we had good data. The ones that did not do that, they had to close. But the ones that were following all those protocols, they did very well. And so I think that to answer that question, it's probably fair for everybody just to keep the schools open and send the kids as much protected as we can. And how can we do that? Well, teachers, right? They need to get the vaccine because they are really good spreaders. They are adults. Kids in the highest school, right, middle school, that are more than 12 years of age, there is a vaccine available. Please get the vaccine. Because and follow all the other measurements, because all these other mitigation measurements are going to keep schools safe, as a safe place, even for the ones that are having underlying conditions and medical problems that COVID can be fatal on them.
And on that note, with kind of quarantining and keeping your kids out, if one parent, if a family, I should say, sorry, has a sick child, how okay is it for a non-sick child who didn't test positive go to school? What's the risk there?
Yeah, so the CDC has some recommendations about, in general, and to make it clear, because like you say at the beginning, right, Kevin, a lot of people get confused with what it says and what it exactly doesn't say. And so to make things clear, you consider exposures. First of all, you have to define exposure. So exposure is if you were beside someone less than 6 feet away, right? And so too close, or 3 feet in the classroom, and you were not wearing your mask, right, in the classroom, and you were with that person more than 15 minutes, right? But at home is different, because at home you are with that person all the time, and since the sibling is infected, if it is true that it's infected, he can be spreading the infection even 2 days before. So there are two kinds of, that first we need to define if that kid was exposed or not, right? So if they are at home because they are exposed but they don't have any symptoms, maybe yes, sending your other kid that doesn't have any symptoms is fine. Now the other thing to consider is whether or not they are vaccinated, right? So if the kid who is exposed at school is vaccinated, then when they can continue going to school if they wear the mask. all the time. And they do have to do a test 3 to 5 days later, just to make sure, and still, wearing your mask. And so that will be like, if you are vaccinated. If you are unvaccinated, then you probably, if you are exposed, you probably should quarantine, which is stay at home. And so, for example, if the child in high school was vaccinated, then you are good chances that you still can send your kid to school, your other kid. But if there's the one that was exposed was the little kid who does not have the vaccine, then in that case, you will need, that kid needs to quarantine. Now, the brother who is in high school doesn't need to quarantine because he's vaccinated. He can go back to school. So that's where probably the confusions, right? This is yes. Even when I am explaining it and I understand in my head, it still is confusing to say. But yes, basically, if everybody's vaccinated, then exposures are gonna go to a minimum, and you may not need to send always or to keep always your kid as at home. Um, and if you are not vaccinated, your kids are not vaccinated, then those exposures become like more important. And then you
Mm-hmm.
will need to test. And now the other thing is that anytime if a child has been in contact with anybody who has been COVID positive, and they develop any symptoms, even if it is just runny nose, even if it was only 100 point, for temperature only one time, then you should definitely get tested.
Just treat everything like it is just in case, because you don't want to have that child spreading it to anyone.
Exactly. Because, like you say at the beginning, I think that, some of those transmissions in a school is because, yeah, they had minimal symptoms. And, in reality, the majority of the children that are infected with COVID really showed with minimal symptoms or no symptoms at all. It's incredible.
Okay, we
So,
do have some questions regarding testing. So there's
Mhm.
two. Mason wants to know whether or not a blood test can be used instead of a PCR test. Tell us why the PCR test is the most accurate and perhaps preferred method for COVID infections.
That is a great question. I actually, and I'm very glad that somebody asked that. So the test in the blood is only to look for the antibodies, to look for the response to from the body to the infection. So it's not telling us that they are infected right now. The only test that can tell us if they are infected is the nasal swab, either for antigen or for PCR. So the fact that you have those antibodies will tell me as a physician that you had the infection before. You may not have had a lot of symptoms. You may not even have known when that happened, or not even be in contact with anybody with that was infected, but still you did have the infection. There is no other way unless you get vaccinated. And the tests that we do to get the antibodies from the illness are different. Those antibodies are different than the ones that we test to check if you respond to the vaccine, for example. So they are different types of antibodies. And so, bottom line, if you test in the blood, it means only that you had the infection before, or you didn't have it, or you haven't created those antibodies. If you're having, let's say you start with symptoms today, right? Your immune system is not going to react, it's not going to produce antibodies until at least 2 weeks from now. And so during that time, you will not have those protective antibodies, and you may be negative, but in reality you are positive because all the virus and the viral load is here in the nose. It's not, you haven't created those antibodies yet.
yeah, there are some people, especially in the Cayman Islands, saying, "Oh, there's a blood test available," and so I'm very glad that you explained that. I mean, I was also sharing that that's just not true. So,
Mhm.
we appreciate you clarifying that.
And since we're on the subject of testing, can you talk about this lateral flow test or saliva swabs, which
Yeah.
apparently are available in some places, such as the UK, and they're saying that they're less intrusive? Are they just as accurate, or what is the situation there?
Absolutely. And like we were saying before, everybody's trying to work things better for everybody, right? We I have just an in my experience here in the hospital where I work, we have a great lab and we tried the test, but we couldn't validate it. People who were infected had really thick saliva, so it was hard to make sure that the positives were the positives and the negative were the negatives. And so it was really hard, and we couldn't use it at all. I am pretty sure that there are a lot of companies that are trying to make that test very, like very sensitive and very specific. I know that another hospital here in Florida started using it at the beginning of the pandemic, and they had to stop it because they figured it out that there were a lot of cases that were positive, but the test resulted negative. So the test was not as good as we thought. So I will be the first one to try that test, but obviously we have to validate it and make sure that those are performing well before we can commercially distribute them.
On that too, I just saw an article actually today, Dr. Espinosa, where it's very similar to what you're explaining, where there, I think it's Quest Diagnostics I saw, is creating a thing that tests for COVID and influenza A and B.
Yep.
So, you just take one test and you know whether it's the flu or
Yep.
it's COVID. And I mean, there's a bunch of different things that are being researched, studied, and obviously have to go through the approval process before it could be fully out there and stuff. And just on that, flu season is upon us. I
Yes.
think our first reporting week here is this week. And so that means flu shots and COVID vaccine. Should children be getting vaccinated? Can you get it at the same time?
So, a couple of things. I'm so glad you brought that because, yes, we don't want to see what bad things can happen with flu and COVID. So, you don't want that to happen to your kids. And so, last year we didn't have a COVID shot, but this year we have for the 12 and older. So, those kids should get it. Now, should you use the same visit? Absolutely. If you can, that's fine. The only thing that we are recommending is, and the CDC recommends, is obviously, if you are doing a lot of shots at the same visit, maybe because the patient is, let's say, 11. At 11, they get 3 shots, and so you can use 2 different arms. But if you are using the same arm because you got a lot of shots, then you try to do the COVID shot at least 1 inch, 3 inch apart, no, 2 inch apart of the other ones. So yes, you can do it definitely, and it is very important that we vaccinate against flu all our children. So the flu is not gonna be, ramping next week, and we are not prepared. Remember that, as I say, the vaccines and the immunity really takes a couple of weeks, and so we need to be, to get our shots before we are gonna be exposed.
Sandra, you got more questions coming in?
Yes, we actually have a lot of questions this evening. Thank you so much, Nancy, for saying that she's going to be getting her booster shot soon. Unasis says, in a household, should we be testing the babies as well? Is it sufficient when the rest of the household is tested? So say you have a household, I suppose, of 3 or 4 children, and the other ones are in school. Should you also be looking to test the youngest of the bunch?
So I think that if the little one has symptoms, definitely. But what we are telling everybody is that, yes, with the school opening in Florida, for example, we didn't have masks for the first 2 weeks of the school, and we saw a lot of cases, right? And so we are telling us to isolate, right? Once you are infected, once your test is positive, you are not in quarantine anymore, you are in isolation. So those patients should be isolated, like a specific room in the house, hopefully the one that has a window, farther place from the rest of the house. Hopefully they can be contained in some, in a couple of rooms or something like that, so they don't go around the whole house, so your baby doesn't get infected. That's the baseline. They should wear a mask when they are not outside the room, for example, and everybody should be like washing hands and all these things. So, but bottom line, if the baby doesn't have any symptoms, you probably don't need to test them. They most of them are gonna do just fine. Now, if the baby start having fever, coughing, or something like that, definitely and take them to the hospital, because they are gonna need to rule out that there is it is not something different. With COVID, we have seen a lot of co-infections, and that's what we were worried about flu, and why we are definitely supporting vaccination, because we have seen a lot of co-infections. So kids come with COVID, but they have something else. And so you don't want to miss that something else if you just keep the baby at home, especially if they are less than 2 months of age. They should be seen.
Very good. Should masks be mandated for children 5 and under?
So masks are very efficient in what they need to do, and they are not at all harmful for the kids, right? But when you get to the ages of 2 and less, they just don't know how to tangle, or taking it out, and they may be tangled on it. So we worry more about that process really, and because they don't know, it's hard, to explain a 2-year-old something and why and how and all these things. And so if they are less than 2 years of age, there is no need to make them wear the mask. But above 2 years of age, you can start training them before you go to any place, or take them out of the house. So when they go to places, and especially if there are places that are indoors that you are taking your child, then you can wear the mask. And definitely daycares, kinders and kindergarten and all that, they should wear the mask if they are older than 2. Same thing with traveling, trains, airports, all that, they should wear the mask if they are older than 2.
Some people might argue, though, Dr. Espinosa, that how can you get a young kid like that to wear masks? Is it realistic to even expect them to wear the mask? What's the experience been like?
Oh my God, I work with kids all the time. My child is older than that, but she will cut me like getting out of the car without my mask, and she will panic and not let me go anywhere until I go back and get my mask. So the point is that they are getting better than us for all these things. And, for, 2, 3 years of age, right? That's the only thing that they have known is COVID and masks and all this. The other thing is, if you wear the mask, your kids are just going to learn from that. And so I have, I really, by my experience, I can say that kids handle the mask much better than the adults do. They complain less, they understand, they get it, and they use it. So I'm not worried about the kids. I'm more worried about the parents.
Sandra, what else we have coming on in?
Very, very interesting point. We have Trilby, who's also asking about whether or not it's realistic for a 5-year-old to wear a mask all day. I think you've pretty much just answered that question. Jackie Miles wants to know, she says, not sure if the doctor would have any information on this, but is there any indication that the vaccine will be considered for under 11 in the UK, the same or similar time frame as the US? So, obviously each country has to go through its own approval process. Are you familiar with anything that's happening in the UK at all?
So no, I actually was contacted by a friend who has a granddaughter that lives in Australia, and they were starting vaccination 5 and older. So they are already in that process. Now for UK, I know that they started the studies even before than in US. But you're right. Every country has their own regulations, and I was just talking to the people from the company, from Moderna, for example, who started the trials even before than Pfizer, and they were not sure why it was taking like longer there. But bottom line, yeah, it will be. I know that that in other countries it has been already approved. And so we are all looking at those countries and seeing what are we what are we going to do, and how they are doing in terms of adverse events and things like that. But I don't know if they are going to be the same time at all, because it all depends of the organizations that are in charge of approving those vaccines, right?
Mm-hmm.
I have a question for you, Dr. Espinosa. Especially now that a lot of parents are, having to deal with a positive child at home in Cayman. Um, some of the things that people are saying is, well, I don't know, should I treat my children with any over-the-counter meds if they have any little symptoms? What are some of the do's and don'ts, and what are some of the general tips?
Oh, yeah, that's a great question. So I'm going to start with the don't. Don't wait with your child at home if they have any problem breathing. Respiratory distress. If you are seeing that they are breathing really fast, faster than they suppose, then take them for evaluation. Now, fever is very common with coronaviruses. Remember, coronavirus, SARS-CoV-2 is only one of them. There are many viruses that have been actually causing common respiratory infections for many years in our children. About 30% of the common colds are really due to coronavirus. So those coronavirus can cause a lot of fevers. So fever you can treat with Tylenol, acetaminophen, ibuprofen, one of those over the counter, right? Allergy medicine for sneezing should not be used neither in children, especially less than 2 years of age. Cough is an interesting symptom because we tell everybody, oh, don't worry about the cough. The cough, it's gonna just get all the plug out, all the secretions. It was unfortunate, but I saw a kid in my practice, a 9-year-old, that was coughing that hard that he broke his vocal cord. So when he came to me, he couldn't talk. And so there are so many like ramifications of the complications and the symptoms of COVID. So I will say,
Mm-hmm.
if the child is not getting better, you have to seek attention. There are some medications that we can use for some of the symptoms at least, and that will help. So don't suffer with your kid at home. Always, contact your pediatrician and make sure to see what they are doing, how they are doing the visits. Telehealth has been really an important method for communicating with families, and we can see each other, and I can see how the kid is breathing, and I can tell that mother, go to the ER right now, or no, you can keep them at home. Drink plenty of fluids is something that we always recommend. And the hot soup is always a good idea. Hot tea is great for soothing the throat. So those are common remedies that we can still use at home.
I've told a lot of people too, Dr. Espinosa, this is a good tool to always have. Get a little pulse ox. Everyone should have it. Just like a band-aid, a little first aid kit. This should be in your little at-home kit, because this could tell you a lot. And if your numbers start to go down too low, that's a good indicator you need to get to the hospital.
Yes, that's true. In kids, it's not that reliable, but it works, and it's just looking at them. If they are breathing too hard, if they are having trouble to get the air in, then definitely you need to take them to the ER as soon as possible.
Okay, Christine wants to know that is it reasonable to lock down an entire classroom even if they test negative? So I don't know that that's happening, but
I don't think that makes a lot of sense, right? If you
yes.
if you got an exposure and you test the kids that were closer to the patient, right? And remember, that's what I rephrased, or I remember what the definition for close contact was. So if you test the kids that were around and you quarantine them in temporarily, and then you did the test and they are negative, then perfectly they can come back to a school, and you don't have to close the entire classroom.
Mm-hmm. Now we know that adults can get COVID more than once. Can children also get COVID more than once?
Absolutely. They also lose their antibodies, and so they are not protected anymore after an infection. And then remember, there are other strains, so they may be, good for one strain, but not for the other one. And so that's the reason why, even if your child got COVID last year or this year, you still want to vaccinate when the vaccine is available.
on mask. Is there a better type of mask? And what about your thoughts on face shields?
Yeah, so the face shields are actually have not been proven to be as effective, right? We use it in the healthcare world when we have really high numbers of community transmission, but in classrooms they have not been studying, and we don't know really if they are working or not. Now, mask, great tool. I told you guys about that. It's very important to make sure that it's well fitted in your child's nose and mouth. And so, if you are using a just cloth, try to get one of the two layers at least, or wear the surgical mask. But it has to snugly like fit in the face of the kid, so it actually work. Um, that's what I probably recommend. Surgical masks are good. That's what we use in the hospital. That's what I sent my own child to school with, because she still cannot get the vaccine yet. And so, yeah, and I was surprised to see that the majority of the kids at school were wearing the surgical mask too.
Mm-hmm.
But that's middle school, so I don't know. It's difficult to get those for little ones.
Yes. So moving on to another question about masks. So Tara wants to know, she says she's got a 6-year-old child. Can they alternate between a face mask and a face shield? Now, I know that locally there's some businesses, and I don't know how the schools will handle this, but there are some businesses who will not accept a face shield because of the lack of protection that they offer. But she's suggesting maybe you can alternate from one to the other. I guess she needs to see what the law says here. And she's saying that a face mask, she worries about his sensitive skin and how that can impact the skin, the face, and around the ears.
Yes, so I recommend patients who have issues with sensitive skin just to put some moisturizer, right? We don't do it in kids, but just put it, rub it, and use it where the strips are. There are some other devices that you can just hold, like the handles and the earlobes, that you can just do it in the back, and that way the kids don't have it all the time in the ears. So there are some other ways that we can make it easier for kids, right? But yes, definitely the face shield has not been approved yet, and we cannot recommend it because we don't know how good it is gonna be too. Really, we
Mm-hmm.
use it in the hospital with the mask, not without the mask. So I will be worried about kids using it without the mask.
Yes. And actually, Kevin did share a video with us in case people want to know how effective face shields are. Kevin did share a video. I'm just trying to see if I can quickly put my hands on it. But he did share a video on one of our previous shows about this. And in fact, it turns out that it's not very effective at all. They've actually done the testing, and the testing demonstrates that you almost might as well not be wearing anything if you're going to go with the face shield. So I think parents need to perhaps think carefully about that. The effectiveness has been studied by experts who look at that specifically, and they have found that unfortunately it's not very effective at all.
Yeah, and what you was talking about, Dr. Espinosa, is the thing that I know saves my ears, because when you wear it all day long, the back of my ears would start to be quite sore. And so, I mean, they do sell, and here I got it in Amazon. I know a lot of Caymanians can actually shop and get stuff from Amazon's, or I'm sure some of the local stores might invest in it. But it's something that you just kind of hook the ear, what goes over the ear, you just kind of hook it in these little things that catches it. And then it actually goes kind of behind your neck, or it could be behind your head. You could kind of adjust and put it wherever you want to put it. And my goodness, what a world. It's like night and day. It doesn't hurt where it's in a different location. And it's certainly very, very effective. The only downside I would find is when people are wearing the mask all the time is, a lot of people started to get acne, so the dermatologist might have to get involved. But I would rather a little bit of pimple on my face than to have COVID.
I agree.
Yeah. And how often, I see people with the blue kind of, I guess, not the ND95 mask, but the little blue ones. They're a little bit thinner and a bit flimsier. I guess I don't know what their technical term is for that particular type of mask, but I see some people with them and they've worn them so often that the blue stuff is starting to like literally fall off. How often should you be changing your mask in terms of just hygiene and stuff as well?
That is a great question. So anytime that your mask is wet or
Mm-hmm.
dirty because of makeup or something, you
Mm-hmm.
should change it. And the disposable masks should be wear only once. So if you wear that mask for the day, let's say 8 hours at school, then that's fine. You keep it and then you get home and you throw it away and get another one. If
Mm-hmm.
you're wearing the cloth mask, then you should wash it the same every time it's wet or dirty or something like that, or at the end, after you take it out, so when you get home, just wash it.
Mm-hmm.
So it's very important that people don't reuse them, not reuse them. And then the other thing is that, maybe you were talking about the N
N95.
95 respirators, yeah. So those are hard to put on correctly, and then they come in different sizes because it depends on your face. We have to be tested every year, because if our face change for some reason, let's say we get pregnant or we deliver a baby, or whatever, or the males get the better, or then the respirator is not gonna protect as well if you are using the wrong one. So you have to be tested every single year in the hospital to get the right one and make sure you are still the same. And so that just tells you how difficult it is probably to wear them. I will not suggest that everybody gets those N95s, because it's hard to actually put them right.
Dr.
Mm-hmm.
Espinosa, I have to
So
share with you kind of on that N95 thing, with the fit testing is what it's called, is when I had to get fit, when I was supposed to get fit tested because we had an outbreak, and this is in very early days of COVID. And so I went
Mhm.
into my boss's office, and he had a little machine to do the fit testing to know what size it was. And he said, "Oh, Kevin, you got to shave, because guess what? I'm not allowed to have facial hair when you are wearing an N95 properly, because you can't get that seal." So
Yeah.
that's one of the things people have to also think about. And the
mm-hmm.
next thing I just want to touch on is, when you have a mask, don't use the ones with the valve, because that's just no good.
Absolutely. I think that we got that done. Maybe not. Yeah, we
Yeah.
have been telling people about that since the beginning of the pandemic, because they were very popular at the beginning.
Mm-hmm. Yeah, I still see a few people here walking around with them. Like they look like they're in some movie with this valve thing as
No,
well.
bad idea.
Here's here's just for the benefit of our listeners who are looking at face shields. Here's a demonstration that was done that shows the ineffectiveness really of face shields. 3, 2, 1.
You could just kind of see all that yucky stuff just floating out in the air, and everyone's just breathing that in if they're around them.
Yep. Not that protective at all, huh?
Nope, not very protective. I think I forgot what university it is, but they did this study and I found this, and they posted it. And it just really goes to show that, yeah, it's just not a good solution really at all. I think it might protect you a little bit more if, like, again, if you're in a medical setting where you're taking care of a patient, and they might be sneezing on you, and it might capture some of that yuck. But other than that, it's just not a good alternative to an actual face covering or mask.
Yeah, and what I said, exactly, it's we wear it with the mask on. So we put our mask and then we put the face shield. We don't wear it without.
Hmm. And see, this test was also done with a N95 mask, and so it still put some stuff out there, but nowhere near at the level of the face shield. It's just far less of that yucky stuff floating out in the air.
Okay, folks. So hopefully that's useful. Now, there's certain activities that we know that will increase how much you secrete the droplets and how far they will travel. I think last year we discussed it on our show, like they can go up to 20 feet if you're jogging and exercising and do different things. And that's why gyms and those particular environments are particularly, very, very serious when it comes to spreading the virus. So Ms. Trilby is asking a question that kind of ties into that. She said, should singing be taught in music classes? Or will this help to spread the virus?
Yeah, that's a great question. We have a lot of meetings, had last year, a lot of meetings about that because it was hard. I mean, there are kids that have been, trying their whole lives. That's what they want to do. And it's hard to stop all the extracurricular activities. So we recommend, first we measure like where are they gonna, perform, or where they are gonna, we recommend for schools that the kids will go outside to train, right? But it's hard to perform when they are outside. But that's what we recommended, and be minimum 6 to even 9 feet away, so well spread over the campus, wherever. And for performances, we did measure like the room and the filters and all that, and recommended that the performances were video recorded, so not all the family will feel like going and sitting there in the same small auditorium. So those are things that you can do. Definitely singing is, we have a lot of our breaks from actually churches, right? Because they sing in church, and so they, now everybody goes to church with the mask. One of the reasons for that. So yeah, that is, singing is one of those activities that could spread COVID more than others. So important to keep all those mitigation measurements in place.
Mm-hmm.
Dr.
All right.
Espinosa,
And
sorry, Sandra, real quick
no,
on
that's
this
okay.
one. I know there's been a lot of talks that I've seen on Facebook and stuff where, parents are concerned that getting the vaccine or getting their child vaccinated might affect their chance of having babies, or it messes up a girl's period. What's the truth to that?
Incredible. I nothing. There is no truth on that. We don't, like, I have been trying to figure out like why that rumor was spread, but no, the little piece of RNA that is put into the vaccine goes into the cells of the muscle of the arm, wherever the injection is given, and it disappeared really, like the vaccine. You don't have any more vaccine after 3 hours. But that mRNA is gonna go into the cells of the muscle to produce that antibody, or to produce that protein that the immune system is gonna recognize, right? And so it doesn't go any other way, any other place. It doesn't go to the ovaries. It doesn't travel. It doesn't go to other places. So there is no scientific basis for any infertility problems. Now, if you get COVID, there are a lot of reports of males and females who have been infertile. And if you get COVID and you are pregnant, there is a lot of more chances that you will lose the baby at some point or have problems, than if you get the vaccine. So those are things that people should remember. And then
Mm-hmm.
the period, I just gave a talk like last week with some OBGYN doctors, and I was interested in seeing what they say about that. And they say that the period can get affected by anything and everything. I mean, food, stress, a test coming up next week. So there is really not a lot of data that support that the period is going to be affected forever or anything like that with the vaccine.
Mm-hmm. Okay, so we'll take some final comments. So Rachel was suggesting some ear savers to stop kids and adults from getting sore ears. Apparently they're available
That's
on
exactly what I was
Amazon.
referring to. Yep.
Yeah, so you can check those out. And then also wearing masks that you can wash versus disposable ones.
Yes.
Is there a preference between the two?
So if you are wearing a cloth mask, I
Yeah.
recommend 2 layers, right? And so if it is the disposable mask, again, just wear it once a day, or just during the day, and then put this disposal. Or if it is dirty, just get rid of it.
Mm-hmm.
But in terms of preference, really, if you have 2 layers of cloth, then probably you are gonna be fine. I still send my kid to school with the surgical mask because it's hard to keep the 2 layers, really in the face. And the surgical mask has this little what
I think the pinch, a little metal piece at the top.
exactly, and that makes the fit much better.
Mm-hmm. Okay. And I think there was a recent study. I'll have to see if I can maybe find the link and share it. But there's something recent about which of the mask actually offers you better protection. And they have said that researchers are saying that the N95 mask is still the most effective form of protection, even over a cloth mask. So I think that that's quite interesting. But I'll share that link so that people can go and have a look at that specific study to see exactly what researchers found regarding the protection that's being offered.
So absolutely they are. That's when we use it, when we are gonna see a patient that we know it is infected. But it's hard for everybody to do it. And so that's why the CDC has recommended that maybe that's not what everybody in the public needs to wear when they are lower risk, if they are not really close, or like we are in the hospital, for example, if we are examining those patients.
Mm-hmm. All right. Well, Dr. Claudia Espinosa has been a wonderful guest this evening. She's answered a lot of questions. If you had some final advice for our listeners on, here in the Cayman Islands, like I said, I think Kevin said at the beginning of the program that there's been a lot of positive cases over the past 2 to 3 weeks in our schools. Some parents are starting to feel a little bit panicky. What would you recommend that they do? Like what's your best advice?
I would recommend that everybody follows the mitigation measurements. So wear your mask at school all the time. Try to avoid any crowded places, avoid any indoor activities that are in places where it's crowded, and just choose to be outside and wear your mask, and then wash your hands and try to social distancing. When there is that level of increased spread in the community, that's not the time of doing birthday parties and going to gather with people that you don't know that they are vaccinated. And vaccinate your children, vaccinate yourself if you haven't. Very important, so you guys can keep those levels low in the community.
Okay, well, thank you so much, Dr. Espinosa. Any further comments or questions, Kevin?
No, and I was just saying that really appreciate Dr. Espinosa for taking the time and coming on again. I know you answered so many questions, and everyone who came out, I know, really appreciate you doing that for them, because again, so much different information out there, misinformation, and it's so hard to keep up with all what's going on. So again, I appreciate you so much. I know we worked on many things, and also when we do a Spanish interviews for our Spanish population, perhaps I might be able to bring you back for a special segment for our Spanish population there. But again, thank you so much.
Thank you for the invitation.
Okay, folks. Thank you again, Dr. Claudia Espinosa. She's an infectious disease expert in Florida. Kevin, thank you so much again for organizing another wonderful segment. I learned a lot this evening, and I'm sure that our viewers did as well. Today is Tuesday. What have you got coming up for us on Thursday, Kevin?
Yes, on Thursday, we're going to be discussing the history of COVID-19 and vaccines. So we're going to you got to kind of remember how things evolved over the years. Remember that there was a different name for COVID. It was the novel coronavirus. And we just want to kind of take a look back at how things have evolved over time, because we learned a lot and we still have a lot more to learn. So we're going to dive into that on Thursday's episode.
Okay, great. And who do we have lined up? Who do we have confirmed for Thursday's episode?
Yes, Thursday's episode, let me just pull it up real quick. It's going to be Dr. Paul Klotman. That's who's going to be on. And then next week, Tuesday, so this time next Tuesday, we're actually going to have a virologist on. And we also asked Dr. Tomlinson to be on. And Dr. Tomlinson said that he will be on with the virologist. So we'll have that for this time next week.
Mm-hmm.
And then next Thursday, we have the evolution of COVID-19 and predicting Cayman's future outbreak impact. We're going to have a scientist, Dr. Edwin Michael, kind of going over. So we got a lot of really exciting topics that are going to be coming up over the next few weeks. We're going to keep on going and providing a lot of different experts to provide facts and information, because this is too much nonsense spreading out there.
Mm-hmm. Okay. Well, thanks so much, guys. And I will see you in the morning. I think you'll all be interested to know how I'm feeling. I'll give you a little update in the morning and kind of how my day went. Kevin, thank you so much again. We'll see you on Thursday evening for sure, if not before then. So folks, do have yourselves a wonderful and safe evening. We've got lots to talk about in the morning, including what happened in the Legislative Assembly. So good night to wee. Thank you. Please share the link. The best way to share accurate information, which is what we're providing to our listeners and beyond, is to share this link with at least 5 of your friends so that they can view this show, and hopefully they'll share with their friends and so on. And, just continue to do that. And we hope that we will get there together as a community. So, folks, enjoy your evening, and we'll see you first thing at 7:30 in the morning.